In other words, you're not following my advice for the personal statement, because my advice for the personal statement is it's not an essay for I have the skills and traits necessary to be a doctor. Mission Accepted Season 3. How you doing?
Quite nice. Yourself, Dr. Gray?
I'm doing wonderful. Let's talk about coming on Mission Accepted, sharing your story. You're obviously in medical school or have been accepted to medical school. In your case, you are in medical school. How has that transition to medical school been for you?
It's been something because I got off the wait list in May, and I had a few wait lists, and I'm also married. So it's not just me going to medical school. It's my wife who is, even though she's not there, she's basically taking the ride with me. So we had to make sure that once we got the wait lists, we had to go through the details of finances and finding a new home in a new state and actually move there and set up and make this home for the next 4 years. So
Yeah.
it's been a culture shock, but it's been fun.
Yeah. And was it a big move, big transition where, like, how many states away did you have to go without giving details on where you're at?
Yeah, because I'll give it broadly. We were in the greater Boston area, Northeast.
Okay.
So, yeah, we had to traverse over 2 days to the Midwest, and that was a lot of fun.
Yeah.
So, yeah, we had to bring, what was even more fun was we had to bring the cats out too with us. That was an experience.
Oh, the
We have
cats.
two little cats.
The cats have to come too. Definitely. All right. Well, congratulations for getting off the wait list. What do you think? Well, before we get into what do you think, nuts and bolts, was this your first application cycle? Only application cycle?
First and only.
Nice.
So,
How many interviews?
3 interviews,
Okay. And then the one acceptance.
1 acceptance.
That's all it takes. You did it.
That's all it takes.
What do you think helped you, number one, get 3 interviews? And why do you think 3 wait lists and just the 1 acceptance?
Pros, because I'm a non-traditional applicant, 26, 4 years out of undergrad, and I had a rather interesting route to medical school. I went into EMS when I was a freshman in college, and I felt that was a good way to get experience, clinical experience that I would really value. And it sort of took off and ran with it because things changed my freshman year of college. And I said, now what? Well, maybe you should go become a paramedic as well. And I had my reasons for that as well. And people looked at me like I had 4 eyes and 8 arms, but I went to go do that as well, worked as a paramedic, took a few years off from undergrad, got a lot of clinical experience in multiple settings. That was a really cool story that resonated with a lot of my colleagues who looked after my application. So that definitely was a pro. Coursework, I would say, was average, had its strengths and where it needed to be. Same for the MCAT, had its strengths where it needed to be. But really got to stress the story here. I mean, without that, I don't think I get in.
Okay. And were you pre-med all along?
Yes.
Okay.
Day one. Reasons why it was just 3 wait lists and 1 acceptance off the wait list. I'll give you 5. I think 5 is a good number. Number 1 was I had my bouts of, well, I guess you could call it a mid-undergraduate slump. So we'll probably get to look at that as well. Number 2, there were red flags such as the committee letter we had. Mine was a year out from the application. It was over a year old, and they respectfully had a policy that they were not going to update it, and I went with it. I don't know if that meant anything or not.
Okay.
It's still a red flag, as you talk about. Number 3 is the activities. There were some activities that probably shouldn't have been in there that weren't that significant.
Okay.
Not great. 4th, personal statement. And I'll start by saying there's never one way to write a personal statement. I stuck with your method. Tell your story. Why do you want to be a doctor? At least I tried to.
Yep.
And so still, there's some stuff in there that may not be great. We'll go into one of the stories that can be cringeworthy for some that say, Marty, you put that in your personal statement? I'm like, yeah, it's a big deal. Last but not least, 5, school list. There are probably some schools I had no business applying to, but we'll get to that when we get to that, I guess.
Just one clarifying point. The committee letter being a year old, I don't think is a big red flag. It's very common for committee letters to write one committee letter, and if you don't get in or you don't apply, then they're not going to rewrite it. So probably not the biggest issue, but interesting that you brought it up. All right, let's go ahead and dive into your application. Take a look here. The first thing I always love to point out is, when did you actually submit your application? You submitted kind of day one, right there. 527. So awesome. So you understood, even though this was your first application cycle, you understood the importance of applying early. So that's fantastic. Demographic information is redacted out. You have GI Bill eligibility, but you don't have military. And so I'm assuming that's from a parent having some GI Bill stuff. You did not mark yourself as disadvantaged, and you do just the automatic classification from WMC. They do mark you as socioeconomically disadvantaged. All right, we keep going. No big red flags, which is wonderful. And then we keep going here, and we look at grades. So we have starting off some AP credits that are transferred in. And then some A's, some pass fails, lots of pass fails. Why so many pass fails?
St. Lawrence University does it odd with the biology. You go in, you take your biology, your general chemistry. You have the credits are lumped in for the grade. Lab and lecture are combined. They're not separate. So you're registered for a lab section in your peer, is it peer pod? Yeah. And those are pass fail, but they're sort of lumped in with the main lecture, and your grade ultimately is in the lecture section. So I don't know why that was the case. I just okay, take the pre-med courses.
So all those pass fails in the prereqs, and so typically that would be an issue, but this is where the nuances of each individual undergrad come into play. Schools understand that, medical schools understand that there are nuances at different universities, and obviously you weren't given a hard time with those being pass fail, with getting three interviews. So we keep going. I don't see where oh, here it is. So you get this C here, junior year, BC here, sophomore year. So a little bit of a dip there. I wouldn't call it a mid slump or whatever it is that you called it. You weren't perfect. You weren't perfect. That's okay. Okay. And then you did some post-bac work here. A little bit of post-bac. Is this just for some prereqs that you were missing? Biochem?
Biochem C wasn't going to be good enough for medical school. I had to retake it. I also took a lab with it. It was optional. Felt it was good to bolster my repertoire and sort of stay fresh with courses.
Okay. So just to clarify, a flat C is typically passing for medical school. So you technically could have applied with that. A C minus, on the other hand, is typically where we say that is not passing for medical school. All right, but doesn't hurt to retake and show that you are capable. So great job getting that A. So when we look at your breakdown here, we'll zoom in here to BCPM specifically. We see cumulative undergrad 357. So not fantastic, not terrible, just kind of middle of the road. And then what I love to see is let's look for upward trends. So we started strong, 385. We went down, and then we came back up a little bit. I would have loved to see more up, but we have this 10 credits at a 4.0 for your post-bac. So not terrible, upward trends, probably not a huge upward trend, but with a 357, you didn't need much of an upward trend. This freshman year 385 was kind of saving you a little bit. So that's good.
It was.
Looking at your overall GPA, 362 and 371 all other. So great job. All right. So GPA, MCAT score. So you crushed your MCAT, 512. Great job. Right about average now for matriculants. I think it's like 511.9, I think, for the average matriculant MCAT score. 131, crushing biochem there. So that's you retook biochem and then you crushed it on the MCAT. So that was good.
Yeah, second time around. That was a lifesaver.
Yeah. Second time around for the biochem, not for the MCAT, right? Because it looks like you only took the MCAT once.
Yeah, I'm talking about biochem
Yeah.
because
Yeah. So let's talk about application, because we can see here that your MCAT date is September 2020. You didn't apply until 2021. And you had mentioned that your committee letter is from a year prior as well. Were you planning on applying and then you were like, never mind, I'm not ready?
part of it was also COVID struck
Mm.
in March 2020. And at that point, I said, this is not going to go well. Put it out another year. But I already started studying for MCAT. And so I said, sorry, do the MCAT. I actually wanted to take it in August of that year and say, all right, hopefully it works enough for applying next year. And well, yeah, that's what happened.
All right. So from an academic standpoint, GPA a little on the lower side. Again, not terrible, but probably good enough. MCAT score definitely good enough. And let's get into activities. Do you think you had one activity that stood out amongst all the others?
As the most memorable, yeah, I'd say so. That would have been the EMT and paramedic work that I did in Massachusetts.
Okay. All right. We'll get to that one. So, starting off here, you're a COVID vaccinator. It's funny how a pandemic invented all of these new jobs for pre-meds to do. You're a vaccinator, you're a screener, you're a whatever. And so obviously doing this during the pandemic, marking it as medical clinical, down in good old Weymouth where I used to live. So wonderful. If this was part of your kind of job working at the ambulance service, why separate it out as this distinct thing versus just being an EMT or a paramedic?
I did it because, number one, on my side, it was already chock-a-block with the most meaningful for just being an EMT and paramedic. Really, I don't know. There's some debate as to whether an EMT and a paramedic experience should have been two separate ones. I didn't feel like that was the best way to go about that.
Okay.
But I felt that this should be a separate activity because it was a separate initiative with a separate, like in the company, it was a separate department with a separate patient population, separate intention. Could I have put it in the EMT paramedic one? Yeah, but I didn't because I felt there's discrete differences between working on the truck and working as a COVID-19 vaccinator.
That's good enough. All right. So just talking about basic experience here, I would have loved to see, you said you were a lead vaccinator at 3 clinics. I would love to see like the number of vaccinations given, like how many, I don't know if vaccinations has 2 C's. Anyway, I think it does. Like how many total vaccines did you give out? How many patients were vaccinated, et cetera? Showing impact through numbers is a great way to show some stuff there.
I wish I did too.
Yeah, that's okay. Paramedic training. Historically, I don't recommend putting training stuff on an application because it's not the training that matters. It's what did you do with it, right? You're obviously a paramedic, as we'll see in other activities here. So the training is like assumed, right? You obviously are working as a paramedic. You obviously got paramedic training. And so typically paramedic training isn't necessary. Now, obviously this is a little bit more. This is an extension of your paramedic training, getting more care, the critical care training here. So potentially interesting thing to add here. Again, if it allowed you to do transport with an ECMO patient or something, maybe telling a story or something of transporting a patient with ECMO or whatever in your paramedic would have showed that. So again, no right and wrong here. Training typically is less impactful, less important than what did you do with it, just as a general statement. So good. Obviously, showing that you care about your education, your knowledge, your ability to care for different types of patients. This does that. It shows that type of stuff. Publications. So you're publishing here as well, which is great. And where you published, all that fun stuff. So great job. Cadaver Anatomy and Procedure Lab. So you're So you're having this as a conference. It looks like it was just you go and you learn a little bit more. Yeah, continuing education stuff. So good. You can put that kind of stuff on there. I love the working with someone else and having that impact there through a nice little anecdotal story. 2017 EMS Member of the Year. So that's awesome. Nice award. Shows a lot about you. Receiving this award, your dedication, your communication, your teamwork, all of this fun stuff. Member of the Year probably isn't an award that's just given out to anyone. Good job. Total hours here, just a style thing. I probably would have put 0 versus 1. There's, again, it doesn't really make a difference. Is there a reason you put 1? I'm interested.
It was a 1-hour award ceremony.
There you go. That's super obvious. Okay. Hobbies. So, writer for the Hill News. So, you're at St. Lawrence University. You're writing for the paper. Why mark this as a hobby versus an extracurricular?
I honestly don't know why I put it on there. I guess I could have put it as an extracurricular. I don't know why I put it as a hobby. I felt like to me it was a hobby because there wasn't any pressure to do an article. Hey, Marty, can you write an article?
Yeah.
Not this week. I have a immunology test. Okay, what about next week? Yeah, sure. Why not?
Again, no right and wrong. As long as it's like clinical experience. I was a writer for the Hill News. Like then that wouldn't obviously make sense. So wrote 5 articles, helped edit 4 others during your time with the Hill News. So great. Research and lab, a biology research assistant. And then again, while at St. Lawrence University. So this kind of stuff here, just for a style thing, these are wasted characters in my mind because I think it can be assumed. We can look at your timeline. We can look at the dates listed here and assume where you're at. So saying while at St. Lawrence University, it doesn't really help the description. So it could have left space for something else more impactful. So that's just a style thing. So good. So assisted in these biology projects, unsuccessful attempt to create a neurophysiology model in crayfish. All right. So I love it. So second project. So potentially I would have loved to know, like, why was that unsuccessful? Right? Expanding a little bit more on that. And then second project, examining exogenous steroids on tadpole development. Okay, I always wondered. I wonder what exogenous steroids would do to tadpoles. So dissected thymus glands. How do you dissect the thymus gland from a tadpole? Tadpoles are not big, and thymus glands are just as not big.
Fortunately speaking, the thymus in the tadpole is actually bigger than it is in humans. You can go in with a microscope and micro dissect it out, and it's pretty obvious. Also, they're tadpoles, so their thymus is going to be a little bit bigger because they're still developing, making all their lymphocytes.
Yeah, interesting. That's cool. Did you get any questions about this in your interviews?
No, and actually, one of the interviews they asked, "Okay, we see what you have this year. Do you have any clinical research?" And they emphasized clinical. I'm like, and so. No, not really.
Yeah. Oh, well. All right. So EMT and paramedic, obviously a big part of who you are. Lots of hours here. And so community service volunteer. So this is a volunteer unit that looks like. And so obviously not full-time based on hours and the date range. When you were thinking about making this most meaningful, obviously a big part of who you are, what were you hoping to get across and help the reader understand?
For this one, I would say there were 3 big things. Number one, my passion for not only patient care, but patient care under difficult circumstances. Okay. And that's why I delve into the story with Terry and also with the various, I mentioned the sort of a job description almost in the first part of the activity. But not so much that as the passion. Number 2, the setting. This is rural northern New York where it's an underserved community. They don't have the EMS resources that you would have in Boston or Denver or anything else. You have long transports to the emergency department. And I really felt, I went to go do initially like, all right, I need clinical hours, whatever. What would you do to go in? Oh my goodness, this is actually like serious. And probably helped invigorate that passion and helped inspire me to take that step, even though I was a pre-med, to say, hey, I want to become a paramedic too and help these guys out. It's really a trouble situation. And the third reason was commitment after even graduating, because I graduated in 2018, but I said, I can't leave them alone. And so every 2 months I would go up for like a week at a time, and they let me stay affiliated with them and help them out. And it really has a soft spot in my heart now.
Let's rewind just a tiny bit and talk about why the delay, the several years between graduation and medical school. What was that delay for?
Gosh, number one, so I'm willing to give some context what we'll see in what we're seeing in the application, Dr. Gray.
Okay.
I went to St. Lawrence University. I thought it was a good fit, but I played tennis all my childhood and adolescence. I went there to play Division III tennis. That didn't work out. Freshman year, didn't work out. We'll get to that in a second. So I also at the same time got my EMT my freshman year, and there were thoughts. I was thinking about transferring at that time. Like, well, I'm not playing tennis here anymore. Like, what's up with this? And I found this new passion in EMS, and saw the reality of what it was like up there, and also had the other job back at home in the greater Boston area with being an EMT there. And that's when I became a paramedic and went to training while also doing the pre-med track, which is, oh boy, I don't necessarily recommend that, but I did it. That's history. Had a bit of a slump in college, and I guess I'll let myself be a little bit more vulnerable. This slump coincided with some mental health problems in my hand. I had untreated clinical depression, Dr. Gray, and it was not working. It was not good. Grades were going down. This is, finally senior year, cut my losses and say, hey, something's not right. Go to the doctor. Yeah, Marty, you have depression. Why don't we get you some help? Go out senior year, crush it, throw a no-hitter, as I call it, all A's. And had a bit of a quarter life crisis, I guess you could call it as well. And that's a whole different story. But I said, I can't, first of all, I'm not ready to go to medical school right now. Second, I don't want to go to medical school right now. I need some time to live life, figure things out, do more as an EMT, as a paramedic at that time. And that's the context.
Okay. Awesome. Thank you for that context. All right. So again, back looking at your application, as you had mentioned, right, the description part above, a little bit more job duty stuff, and then getting into a nice little story here with Terry and what that looked like. So great job with the little anecdote. Love the stories. Paramedic training at PERCOM. So again, training again, is it worth putting on? Is it not? You obviously are working as a paramedic here. You mark this as most meaningful. Obviously, it's a lot of hours to go through paramedic training. And so, again, no right and wrong. It is what it is. So you're enrolling here at this training and all the different places where you're traveling to complete your training. And you were able to tell, right? Obviously, through training, you're interacting with patients. It's not just clinical experience, very similar to medical school, where you have your kind of preclinical training and then your clinical training. And so here you have a story of Jeremy here and what you're doing. So great little anecdotes. I love the stories.
For this most meaningful activity, one of the reasons I also put it in there, obviously it was very meaningful, but ideally with a training like this, you would have like a transcript that even if it said pass fail, you could just upload into the AMCAS and say, oh, hey, there, Marty did that.
Yep.
But I couldn't do that with this training.
Why?
Does that play any, there was no transcript. It was a certificate program.
Okay. Yeah.
Does that play a role in when we make decisions about what to include and not to include in activities when it comes to training or not?
I don't think so. If it were just certificates, then everyone who works as an MA, theoretically, because most of that is certificate training, would put that certificate on there before they put in their work as an MA. Phlebotomy, the same, like random stuff like that. So it's not necessarily the training that is important. It's what did you do? People aren't going to look at this and go, oh, wait a minute. I see you're working here as a paramedic or an EMT. I don't see any certificates or training listed. Are you actually certified to do that kind of stuff? Like nobody's going to second guess your your qualifications because you're working as a paramedic. I'm interested to know. So this was an overdose kind of story. Was this the one that people are like, why did you put this story in here?
No, this wasn't it.
Okay. All
Yeah.
right. All right. Well, I'm excited to get to that one. So general chemistry TA. Again, you get into a story of a student versus just very basic general. As a TA, here's what I do. And so that's great. Love it, love it. And we keep going to EMT paramedic. So here's the big one here. 14,000 hours, obviously more of a full-time job, paid employment. So working as an EMT, obviously transporting ill patients and performing assessments. I wonder if you ever transported my grandfather. He lived in Weymouth.
We didn't.
Yeah.
Brewster doesn't do Weymouth.
Oh, they don't. Okay, but that's just
Their
where they're
headquarters is
based.
there. They just don't do it. Yeah.
Okay. I got it. So EMT experience gave me insight into the progression of chronic conditions. So you're talking about what did you learn here, and then Quincy, love it. All right. So being a paramedic involves making clinical decisions, performing interventions to treat a patient. Right? Super obvious. Probably don't need that sentence because, yeah, that's a given. And then we have Tommy. So you get into a story here, which is great. And then what did you do during this call? Survived the transport, discharged a week later, and it's bolstering your confidence. Awesome. Got some shadowing. So you listed here, perfect way to do lots of different shadowing experiences. So that's perfect. Men's tennis here as an intercollegiate athlete. So you were recruited, level 3 regional tournaments, and forming bonds with teammates, which is awesome. So you stopped playing due to injury. That's a bummer. And then you focused on a career. Okay.
Yeah, that's context to it. There was a lot going on, so that was part of it.
Okay. So avid tennis player, and you still play, which is great. EMT training. So again, more of the training stuff. So you have tons of clinical experience. You have some shadowing experience. You have some of the research. What are you hoping to get across in your personal statement?
I was really following when I was writing this your method, which I highly agree with, the telling your story and what's the seed.
Yep.
The problem is I didn't have that one moment. I'd be like, right, I want to be a doctor. There wasn't a one moment. Yep. What I wanted to convey was that this was a passion that built up over time, that obviously this is a profession, a medical profession that is not, taken upon lightly to enter per se, and that I was committed to not only enter it, but to make a positive difference both in the lives of patients and others, like their family members or healthcare or other healthcare workers, and to be a leader. And I feel like that's the big thing with being a physician is in our era, you're a leader now.
So you mentioned leader, and I'm glancing at this first paragraph, and that's basically your first paragraph is leadership. I find it very interesting. People who are Eagle Scouts almost always want to make sure that they get that in their application. Obviously, it's a huge accomplishment to become an Eagle Scout. Becoming an Eagle Scout typically occurs during high school. And so we generally say the rule of thumb is things that happen in high school stay off the activity section. And we still get people who want to put, I got Eagle Scout in the activity section. Like, you can do what you want, and the general rule of thumb isn't. And so it's kind of interesting. The first sentence is, I became an Eagle Scout. Tell me why. I'm interested to know, why is becoming an Eagle Scout such a foundational part of most people's journeys when they do become an Eagle Scout, that they feel like it needs to be on their application?
At least for me, this was the first formative leadership experience that you have, at least that I had in my life.
Yep.
And I'm in the driver's seat. That's it. You have this big project, service project you have to do.
Yep.
Not only do you have to do it, you have to lead it. You have to coordinate the volunteers coming in, the budgeting of supplies, the paperwork, and the approvals from the town if you need it. And this could be a situation where, at it with the high school load, where you feel overwhelmed. And I guess once I do it, you realize, man, I did all this and
Mm.
got this rank and all that. I can do that. Then the sky's the limit.
Okay.
And it really is a formative experience.
In other words, you're not following my advice for the personal statement, because my advice for the personal statement is it's not an essay for I have the skills and traits necessary to be a doctor. It is why do you want to be a doctor? So again, not right or wrong, just not what I would recommend. All right, so you're enrolling in EMT. You're learning that being a patient caretaker was just as interpersonal as it was medical in nature. So you're focused on interpersonal skills here, working with Rodrigo, and then introducing yourself, offering reassurance in his native language. So obviously you have some level of competence in speaking Spanish to communicate with him. And this experience of forming stronger clinical bonds, clinical relationships in these bonds allowed me to render better care. Okay. So the takeaway here is rendering better care versus here's why it's helping me want to be a doctor. Okay. So again, not specifically focused on why medicine, but interesting patient experience helps me see who you are in this clinical environment, which is great. Limitations as an EMT. Okay. Greater role in medicine. So I'm already knowing a little bit of your story. I'm already questioning, wait a minute, you're not telling me that you are pre-med already, right? You just have this, I'm a leader. I enrolled in local EMS to begin building clinical repertoire. I'm not sure why you want to build a clinical repertoire, but you're doing it. You're limited as an EMT. So I'm already asking myself, like, why? Why are you doing this? Right? You got to help me answer these questions. So greater role in medicine, and what are you doing? So pre-hospital patient care and motivating you to help the region, completing undergraduate studies, pursued paramedic certification. Okay? So you're continuing your journey of healthcare, of clinical, of taking care of patients, all that fun stuff. Still, we're 3 paragraphs in. I don't know that you want to be a doctor yet. You told me earlier from day one you were pre-med. So you're missing a piece of your story here. So I'm wondering why were you pre-med from day one, and why haven't you talked about it yet here?
I think I go into pretty good detail in the last paragraph why, but
Okay.
I guess that's something I could have done better was maybe mention it earlier.
Okay, cool. Let's wait till we get to the last paragraph then. So now we're in working as a paramedic. During the response, where are we with why did you put that? Is this paragraph?
This is the story you're talking about?
Yeah.
Or?
Yeah, the one
This is the story, yeah.
Okay, all right. Paramedic, mutual aid, adjacent town. So mutual aid, for people who don't know, like you're going to help an area where you normally wouldn't be covering, right? That's mutual aid in this world. Okay. So child and respiratory distress, juvenile not breathing, sense of urgency, was likely a sick pediatric patient. Great. Requested backup. And then we found a toddler named Aiden lying on a stretcher, placed him on a heart monitor, checked for a pulse, no pulse. Seeing Aiden lifeless on the stretcher with his eyes staring blankly into space caused my heart to sink. And then we go a little bit further. 2 EMTs providing uncoordinated chest compressions and BVM ventilations. So you're criticizing your colleagues here.
Yeah, it was. So going back to it, it is criticism. It was an uncoordinated mess when I got there is a good way to describe it.
Yeah.
And understandably, you have a 2-year-old that's not breathing and emotions are running high. And, well, I guess the adrenaline kicks in and we can't help our patient without intervening and having some order. That's how I approached it. Is there criticism? Yeah. But that's at least how I saw it at the time.
Okay.
We need to do something better.
Got it. So what I would recommend, I love the initiative to improve. I wouldn't call out your teammates in your personal statement. All right. You could have told the same story without saying, hey, these boneheads are doing uncoordinated chest compressions and BVM breathing. Right. So you could have said everything else about taking charge, taking initiative, making sure things are happening without saying these boneheads don't know what they're doing. Obviously, you get to a point where Aiden did not make it. Let's read here. So, reinvigorated passion for serving others. So, meningitis. First experience of directing a group of first responders. Okay, so that's a big part of it. Formed a link between prior scouting endeavors and my role in EMS, since I was no longer just a clinician, but a leader. Okay, so bringing back that leadership. Okay, I still don't see anything about why you want to be a physician. I'm still asking myself, why are you telling me all of this information? Right? If you love your job as a paramedic, why aren't you still a paramedic? That's where I'm at still. So I'm like, where is the why medicine? All right. So for me, telling this story of Aiden, I think is perfectly fine, right? It's not gruesome. It's not happy, but you don't go into like gruesome details here, which some people like to get into, and so that's fine. So the story itself is fine. So that was where it's like, why are you telling a story of when someone died?
That was the feed. Not just that, but why have a child that died? And also, I think someone also commented on the uncoordinated chest compressions and BVM by the EMT, saying, "Sounds like you're what's the word I'm looking for? Well, sounds a little arrogant."
Yeah, it does. It can. And it's not an uncommon thing for students to do. It's not uncommon for students to go, everyone else missed the lab. I found it. I'm the hero. Right? We like to paint ourselves as the hero. And that's great. And you're entering a profession where you're going to be working side by side with lots of other people. And no one wants to work with the person who thinks they know everything. And that's how that can come across. Whether or not you were trying to come across that way is a different story, right? It can come across that way. Working in EMS has defined my character as a leader. Okay, so the leadership trait is the one you were going for here. In your element, managing a team, high quality care. The next step, expanding capabilities as a clinician. So this is the first time where you're actually like, I want to expand. I still don't know why. At least you mentioned here. You want to be a provider. So this is just a pet peeve thing that a lot of physicians have, is not using the term provider to equal physician. So you'll learn more about that when you get into the medical physician world, why a lot of physicians don't like the term provider. I'm a little bit less caring about it because I'm not actually in a clinical setting anymore. But lots of physicians I know in clinical settings think that this is a derogatory term for physicians. So
I learned something today.
Yeah.
Cool.
We're all learning. All right. Position of higher responsibility in healthcare. Excellence in profession. Can I make a difference? Okay. Awesome. So now you want to be a doctor. I think an interesting personal statement. I see a lot of great clinical experiences. I see how the clinical world impacts you and you impact it. I am missing the why medicine part. Why physician, other than you want more and you want to be the leader of that more. So could have potentially done a little bit of a better job connecting those dots for me as a reader, but not definitely not one of the worst personal statements I have read. Not the best personal statements. It was a good enough personal statement. And then we look at school list. How did you go about adding schools to your list? Because you applied to a bunch.
Yeah, I applied I applied to 30.
Yeah.
Well, actually, I sent 31 primaries and 30 secondaries.
Okay.
So, and this changed a lot since I was a freshman. I remember my first school list when I was a freshman in college was basically 20 of the top 30 from the U.S. World News. And looking back at that now, yeah, it's like, oh, rookie mistake there. But I looked at institutions that were a good fit, that read all their mission statements, looked at all their clinical affiliates. So if they didn't have, I scrutinized that probably more than I should have, but if they didn't have a committed pediatric, trauma center, and if they didn't have multiple clinical sites, and if they didn't have, whatever, go on. I guess I was very cautious before applying there. So clinical was a big thing. And also looking at the curriculum and seeing, are you going to get opportunities for early clinical exposure?
Great.
Second thing, obviously, I had to run it by my wife because, like I said, we're in this on as a team.
Yep.
And why 30 medical schools? Well, I knew there were a few red flags in my application, and there were a lot of schools I thought were a good fit. So I applied to
Yeah.
30.
Okay.
Looking back, there were probably a few that, why did I apply there? But all right, it
Yeah.
is what it is.
Yeah. So let me highlight the ones that were potentially ones that I want to make sure that you applied knowing that your chances of getting into that school were probably a lot slimmer than others. So you were a resident of New Hampshire, I believe, at this time. Okay.
I moved. I was a resident of Massachusetts, but I did
Yeah.
not qualify for in-state for UMass because you need like 7 years or something like that in-state. I
What?
didn't qualify for that. It's 5 or 7 years or something like that. Yeah, you have to have like 5 or 7 years in-state for UMass.
That doesn't make any sense. Okay.
It doesn't make any sense.
All right. So you applied as a Mass resident. So just looking at that, you have FAU, which is public, I think. I always get FIU and FAU mixed up because I think one's public, one's private. Anyway,
Didn't submit the secondary for them.
okay, so that's the one you didn't submit. So
That's the one I didn't submit.
Albany's private, I'm pretty sure. Zucker, Drexel, Rosalind Franklin, all private. FIU, again, I forget if both are private or both are public, one private, one public, whatever. I'm going to mark it.
It's public.
FIU is?
Yeah.
Okay. Michigan State, public. Penn State, I always want to say it's public, but it's private. Rutgers is public. UConn public. Florida public. Maryland public. UMass public. Rochester's private, I think. And then Wright State or Wayne State is public. Wright State may be public. I forget.
They're also public.
Okay. So a handful of public out-of-state schools that lower your chances of getting in just because they're typically looking for in-state people. So whether or not you did the research and you're like, oh, this has a larger out-of-state acceptance rate for this specific school, even though they're public, that's great. I just want to make sure people understand that there's that distinction out there. So wonderful. You get to this point. You got 3 interviews. You got your acceptance. Looking back, what would you recommend someone do differently maybe than you?
Well, let me start by saying for those who are an undergrad or not an undergrad, having gone through what I went through, if you have something going on, I'm going to really push the mental health card here. You're not going to be on your A game. And so that's another reason to seek help if you need it from a mental health standpoint. I wish I had gotten help for my depression earlier. The quality of life would have been better and probably would have done a little bit better during the middle of undergraduate. So that's my first big piece of advice. Be on your A game. And if you need the help, always reach out for help, whether it's mental health or anything else. Second one I'd say with the personal statement was that was a dizzying, mind-boggling. I don't probably spent too much time working on it. It was inefficient. Going back looking differently, have someone read it who does not know you. Everyone who looked and edited my personal statement knew me in some regard.
Yep.
The big thing I would say is have someone else who just has no clue who you are read it.
Yeah.
So those are my big 2 things. Can't really think of anything else.
Awesome. Well, thanks for coming on and sharing your story.
All right. Thank you, Dr. Gray.